See, I'm still joining. We got maybe 15 people coming in. Let's see. All right, I think that's everybody in the waiting room as of right now. Hello, it's great to see everybody. Thanks for joining us on another Hormone Happy Hour. I see some familiar names and then I see some new names. So um, if you'd like, go ahead and drop in the chat. Let us know where you are connecting from.
You gonna do what? Oh, she is.
Give me one sec, guys. There we go. All right. Sorry about that. I want to start with oh, great. We got some people popping in here. Connecting from LA. Karen, nice to meet you. I see Pittsburgh, about an hour away from Pittsburgh. Mandy, another one from LA. Got PA in the house. I'm calling from Arkansas, so Midwest. It's great to have everybody here. I wanted to open up with a Q&A. I see some new names here. I would love to have y'all pick our brain, ask us some questions, utilize your time here. We have all our experts. Not everybody at once, please. Right. When That's a good question. Let's start with this. When taking creatine and collagen, can they both be taken together, and does time of day matter? I really think of creatine almost like a multivitamin. So it takes time to saturate you to get enough to build up in your body. So, no, I would say creatine, a lot of people will recommend it pre, intra, post workout. I think that just taking it daily, whenever you can remember, because we're all really busy. So, being able to just add it to a shake or in your water. Similar with collagen, I think you probably can have some improvements mixing with a complete protein source post workout because you're going to get different amino acid profiles. You're going to have less essential amino acids if we're using a collagen, and then you can get in some of those essential amino acids through like a whey protein or a vegan protein, whatever source you're using. Coaches, do you have any additional input on that as far as creatine and collagen dosing?
I would say like anything, like just making sure that you're taking it daily in order to make sure that over the timing. But they do say like creatine post workout is when it's like most beneficial in terms of like muscle recovery and everything. But like again, if that doesn't work with your timing, it's better to just like let's say if, when you remember the most to take it is like in the morning, first thing in the morning, do it then. It's going to be more beneficial than you just doing it sometimes post workout because you don't even work out every single day, but you still want to make sure to take it every single day. That's all.
Yeah, thank you.
Yeah, I haven't really seen it matter when someone takes it. I've had people take it first thing in the morning and they notice benefit throughout the day, but others seem to be more in sync with their body and they feel like, especially around workouts right before, it's like the biggest bang for them. Others notice cognitive effects, supporting, just thinking clearer. And I think I've seen it hit people very differently. And then some people are like, I hate it. It hits my gut wrong. So depending on what type you're using, it can have different variable effects, I think, too.
Yeah, thank you. And Mandy has another question here. Can they be put in a protein source all in one shake then? Yeah, I would say that's fine. I like a collagen and I use a whey isolate because it has less lactose in it. I like that post-workout. It's easier on my stomach. And then I personally like the collagen from like the connective tissue standpoint. Think, being able to preserve your joints is probably helpful for all of us as we age. So, yeah, don't think there's really an issue with that. I think collagen protein sometimes mislabeled. You'll see like, oh, 20 grams of protein. But again, you're getting all of those other non-essential amino acids. They are important and they have other factors in the body that they help with, but they're not going to have the same effect on helping with muscle protein synthesis like leucine, isoleucine, valine, those common essential amino acids. So great question. We have some new faces. Does anybody have any questions in regards to, oh, here we go. Have one other person jumping in. Let's give them just a sec. Does anybody have questions about hormones? We usually do a deep dive on all topics, but I wanted to see with all of the new users here, if anybody had some specifics, peptides, hormones, testing, and let us answer away for you.
I have a question regarding peptides and hormones, actually.
Sure.
So I'm in Canada. We don't have peptides accessible to us. You get a prescription for NAD, but I'm looking for a menopausal stack, anti-aging, cognitive, hot flashes, and I know that it's pretty common with the Americans that I follow online, but I don't know who to go to here and how to get them here.
Yeah. Where are you located? I have a couple
Toronto.
clients in Canada. Okay, in
I'm
Toronto.
in Toronto and I'm in Mexico as well. I'm in Playa, so if you have anything on either end, that's great.
Yeah, I think Toronto. I'm pretty sure Davey had an integrative practitioner he was working with in Toronto at one point. Let's see if I can get that information for you. So let's talk about things that would be beneficial, maybe from a hormone replacement, and then we can get a little bit more advanced into peptides. So I think really the things that I find most important as you age is protecting your bones, protecting your cardiovascular system, and your brain. Basically, we look at Alzheimer's and glucose utilization in the brain. Estradiol has a big impact on how your brain is able to regulate glucose. So if we look at um, Alzheimer's, dementia, the buildup of beta amyloid plaque, that's usually associated with the inability to regulate glucose in the brain. Estrogen is going to play a big role in that. So if I'm thinking of important things, testosterone, estrogen, progesterone, and then depending on the individual, those amounts would vary. So I wish I could say, Yasmin, you need this specific dose of testosterone, estrogen, and progesterone. But if you are maybe perimenopausal, you may be looking at replacing testosterone and progesterone. And as the ovaries start to make less estradiol, wanting to replace those things. When we look at the hot flashes, estrogen and progesterone is going to have a lot to do with how you're regulating your body temperature. So if you're waking up 2, 3 in the morning and your bed soaked and you have some insomnia, I see estrogen really being the thing that helps regulate that. When we look at using bioidentical estrogen, I think everybody's so obsessed with getting enough in the body. And as a collective, as coaches, we spend a lot of time looking at your body's ability to excrete those. So if we're taking hormones in, we definitely want to make sure that our body's able to detoxify those things and regulate those hormones, because any hormone can be problematic if you're recycling them. Same with toxins. So I would say working with a practitioner who's going to be able to prescribe those things and then doing appropriate diagnostics. So I usually recommend blood serum testing initially to see where your hormones are. From there, getting on hormones, and then potentially doing some more advanced testing. So you could look at doing something like a uh, Dutch Complete, which is going to
Yeah.
show your phase one and phase two estrogen metabolism. I think a lot of people still have fear around using bioidentical hormones and, the whole cancer debate. Really, what I like to have people think about is if you've made estrogen for 40 years and it never caused you to have cancer, why would taking the same thing out of a bottle that your body makes suddenly cause cancer? I think a lot of those things are going to be tied to one, genetics. Some people are predisposed to that, and two, your ability to clear those hormones. So as you redose those, your body is able to excrete them and use them appropriately. So those what I would recommend from the three bioidenticals. Things that I think that are helpful for both aging men and women. Uh, Working on things to regulate sleep cycle. There's lots of peptides that work specifically on circadian rhythm. One of the ones I'm really fascinated with is something called epitalin. It's also known as pinealon. It's a pineal gland peptide. So as we age, our pineal gland calcifies and we make less melatonin. What epitalin does is it reduces that calcification and it helps with the natural pulse of melatonin. Melatonin should be highest at night. So what this peptide does is help you regulate the melatonin, and then it's also going to help with your wake cycle because uh, cortisol and melatonin kind of work as antagonists of one another. So you being able to get more melatonin at night will suppress cortisol, and then in the inverse in the morning, your cortisol is what suppresses your melatonin. So that's kind of like something I think is really kind of top tier. There's also some information around it supporting cardiovascular function. And obviously, it's going to have a very strong antioxidant profile to it. So that would be up there. And then I'm going to do honorable mention. Copper peptide's really cool. I don't know if anybody's heard of that, but I think everybody would like to have nice skin. So GHKCU is another one that I think is really cool. Basically, it just helps with collagen synthesis. It's great for hair, skin, nails. It also has some antioxidant functions with it as well. There's like 300 peptides. So, Jasmine, if you have a specific question on a specific peptide, I'd be happy to answer it. But those are maybe some of the ones that I think are really unique and could shine in a peri or postmenopausal setting.
Okay. I don't have a more specific question, I don't think.
Okay.
Just if you when you ever get a chance to forward the information for the integrative clinic here, that would be great.
Oh, yeah, absolutely. I'll take a note of that right now and get a message going with Davey.
Justin, I messaged Davey on it
Perfect.
while we were
Thank you.
chatting, so I'll wait to
Thank
hear if
you.
we hear from it. I'll put it in.
That's awesome. All right, I have a question from Amber here. Any recommendations, biggest bang for anti-inflammatory results when the aches and pains of joints are flaring up? Um, I have some thoughts. Can I pass this to one of the coaches and maybe we can all chime in a bit on things that we think are really big needle movers for inflammation?
Okay, so just as a personal testimony on joint pain, cleansing the liver can be really, really huge in this. Um, a lot of joint pain can obviously be associated with poor lifestyle choices over time, which can burden the liver, so toxin overload and inflammation. Um, and histamine overload and gut axis and leaky gut. So obviously the foundational lifestyle pieces are great and usually you see that help people significantly with joint issues. But if that is not enough, then I always like to say go to more of the advanced cleansing route. And it's not going to just be one and done. This is going to be time, like over the years to do liver cleansing and even gut cleansing. But I had really bad hip pain, and that went away with just doing a liver cleanse. Now, this is just one anecdotal story. This doesn't mean everybody's hip pain is going to go away, but I thought it was quite fascinating, and I had a lot of pain in my fingers too. joint pain. But the more I worked on cleansing, the more I think whatever I had causing issues with my liver function and being able to detoxify toxins and store them. I think if we're sluggish and overloaded, we're going to store toxins in different areas of the body joint wise. It's going to be different for everyone. It's going to hit differently for everyone. But the more I found that I cleanse, the less pain I have with joints overall and even lower back pain. So that's just my little experience, I will say, with cleansing and eating healthy, of course. That's very important.
Thank you.
Yeah.
I'll jump in. I would say, a little following that a little bit. When I think anti-inflammatory, I think at a lot of different levels. Like, I kind of hate this word, but clean eating. So, you know, really removing, processed foods and fried foods and eating just as whole foods as possible. Nothing out of a box, nothing from a store, whatever, as best you can. Lots of fruits and vegetables to get like antioxidants there. And then also whether supplement or through food, omegas, turmeric, curcumin, I think are great for anti-inflammatory in all of those. And I know, I feel like I said this last time too, but inflammation can come from, I'll say, the mind and overall lifestyle. So then we're looking at sleep and stress and joy and all of that. I think absolutely has a big impact on how our body holds on to inflammation or creates inflammation. And then last thing I'll say is just, obviously I already mentioned omegas and curcumin or turmeric, but I also think that there are some other supplements that can be helpful depending on what you're dealing with. Um, um, but some of those, MSM is one I've used a lot for joints, and then also like glucosamine and chondroitin too. So just a couple of supplements there that can be helpful.
Awesome. Thank you. Yeah, I would. So go ahead, Sophie. I seen you unmute yourself.
No, I was gonna say, yeah, specifically like nutrition wise, making sure that you're eating like whole foods, seeing if there's anything like the inflammatory foods as well, like seeing if there's anything that you're eating that causes inflammation. And many times we don't realize it. The example that I always give, like in terms of like alcohol, dairy, sometimes gluten for some people, it's that sometimes we don't realize. And I always say, like, imagine you've just always had like a wound and you always have like a finger just stuck in there. So you don't even know how bad you're feeling. So it's like pull it out for a little bit, see how it feels, and then reintroduce that food and see if that's what's been causing it. Because sometimes those things can cause that, as well as what Ashley said is stress. Stress management is so, so, so important. Like, how do you manage your emotions on a day-to-day basis? Do you feel like you get stressed? I think Justin said this the other day. I was driving and it happened. Is that somebody cuts you off in the road, right? Like, what do you say? Do you start cursing them off? Do you get angry? Do you let that ruin your day? Or for me, like what I always say is like, oh, they must have to go to the bathroom. And I laugh. Like, it's finding ways to manage your stress, manage those daily stressors, because like life is always going to be lifing, as people say, and just managing those emotions and finding ways to enjoy life more. But then also, like nutrition, sleep is such an important factor. Like, are you sleeping enough? If not, finding ways to sleep better as well. Because inflammation can come from so many different things as well, that it's definitely a combination of everything that can add into that. So just changing small things in each area, I'm sure can help a lot in bringing down that inflammation.
Thank you. Yeah, I think all of those are really good. And Amber, you may be looking at this and be like, I do all those things and I'm still inflamed. Okay, so you don't. So that's a great place to start. Okay. I would say like the nutrition is the biggest piece. So if I go and I eat a bunch of fried food for like 2 or 3 days, I don't really do that, but occasionally I do. My knees hurt and my hips hurt. And, I just notice even the amount of brain fog I have. I'll be lethargic and not feel well. I have 2 small children. Sometimes they want pizza, and I may have a piece, and I really notice those. So Sophie gave a really good example. So if you remove some of those foods out of your diet, and you have a reduction in inflammation, I would start there and then reintroduce something, see if you have a flare up. But what I see is a lot of people were just so accustomed to living with low grade inflammation that we don't realize that it's there. And if we look at the progression of disease, inflammation is kind of a starter of all of that. So it may be low grade, but the longer we have that, systems in our body start to downregulate. So I think about food. I think about sleep is another place where we're getting a lot of anti-inflammatory benefits, stress management, and then supplementation. I like omega-3s. I think detoxes would definitely have a place in there. I like to get lots of antioxidants in my diet. I'm a bigger fruit guy than vegetable, but your dark berries are going to be your best ways to get more antioxidants into your body. Same with your leafy greens. If you can digest those and you like those, those things can be helpful as well. And then you could get even more advanced into peptide therapies. If say somebody's on this call and they're listening and they're saying, "Oh, I'm doing all of this other stuff, but I'm still dealing with chronic inflammation." You want to rule out autoimmune disorder is probably one of the top things I see with women coming into this program is they never got appropriate lab testing done. And we'll find things like Hashimoto's, or we might find some dysbiotic bacteria in the gut. And those are really good places to get an idea of where that inflammation is coming from. So, there's pharmaceutical routes, there's supplementation, but nothing is going to help if the nutrition and the lifestyle pieces aren't there. So those would be places I would recommend to start with. Amber, did we answer your question? Awesome. All right. So I have another one here. I'm 56 in perimenopause. I'm on HRT, estradiol, micronized progesterone, and testosterone. I went 7 months without a period, but I have had them in the past 4 months. I also have fibroids that's causing cramping, but not heavy bleeding. My uterine lining is normal. Okay, I'm glad they checked that for you. My OBGYN is recommending a hormonal IUD to lessen or prevent the bleeding. I'm not sure I want to go that route. Just wondering your thoughts on them. That's a really good question. The things I think about when we look at, oh, did you have some additional to input? Please go ahead.
No, I just didn't want to be rude and not show my face when you're answering my question.
Well, it's nice to meet you. And let's look at this. So the things that I would think about, you are 56. You went 7 months. So you are really technically perimenopause. You can't get that stamp until you go that 1 year
Right.
without bleeding.
Yeah.
I have another client. She went like almost 365, and right at the last month of her cycle, she bled.
Yeah, that's so rude.
The thing is, I would say you're probably getting very close. If you're at 7 months, you're having a really large stretch there. The thing I think a lot about with fibroids is the body's ability to detox or get rid of estrogen. So that's a big piece. So if you're taking in that bioidentical estrogen, I'm glad you're taking the progesterone. That's going to help with that uterine lining. It should help with the fibroids. But if you are recycling those estrogens, you could have increased blood supply to those fibroids, which can cause them to grow, which could cause that cramping. So usually what I think about is supporting phase 1 through 3 of detoxification.
Right.
I'll just give you some easy things that you could think about. Usually getting enough sulforaphane in your diet. That's a fancy term for what's in the brassica family. So you look at broccoli, cauliflower, Brussels, if you can digest those. If you can't, you can take that in a supplement. That's really going to help with your preferred pathways of estrogen. Some can be more problematic. So you have a specific 16-OHE1 metabolite of estrogen that is known to cause proliferation of tissue. What that sulforaphane does is help you favor a more preferred pathway. If we get into phase 2 estrogen metabolism, having enough folate, having enough B vitamins, I would say all of the Bs are going to be very helpful. You could try to get that from protein sources if your body's able to extract those B vitamins. I usually would recommend, and I would test before taking a bunch of supplements, but some sort of methylation support.
Right.
If you've ever done a lab review with me or anybody on this call, and you have methylation issues, I like a
I
product
do.
called homocysteine supreme.
Hmm.
That's going to help deactivate those estrogens. And then phase three, really, if you have an upregulation of beta glucuronidase, you being able to one, probably look at gut dysbiosis and correct that. But two, calcium deglucarate, if we're just giving remedies, is something that we use a lot to help with that end fate of estrogen. The last piece is you have to be able to poop daily. Just like
Hmm.
very layman's, like if you can't use the restroom, you can't excrete your hormones. So,
Hmm.
kind of thinking of reverse engineering that, you probably have a hang up in one of those detoxification issues. Um, what forms of HRT is that? Estradiol patch and a testosterone cream?
Gel, estradiol gel and testosterone gel.
Okay.
Hmm.
The other piece that you may want to look at, because your ovaries are still kind of working, you obviously
Hmm.
are making some estrogen some months. You may have too much estradiol there as well.
Yeah,
So
she has tested it and didn't think that it looked like it, but
the thing is, if you don't look at further testings,
uh-huh.
you're only looking at the estradiol. You have three types of estrogen, and looking that over a 24-hour period in a urine sample is actually going to be more beneficial to monitor HRT versus
Yeah.
just looking at estradiol on paper. It would say, okay, it's a that range could go up to 400, and you may be at a 200, but you're having all those symptoms. So further diagnostics would be my recommendation on something like that. My thoughts on hormonal IUDs. Uh, it may help with some of the cramping initially, but that's a band-aid.
Hmm.
Are you going to keep a hormonal IUD in you for 10 years? At 56, I probably wouldn't recommend that.
Right.
Um, I would be looking more at root causes to figure out what's going on.
Okay.
Do you, do you have any, if you're open to sharing, do you have any other health concerns? Do you have any autoimmune disorders or anything else that's kind of sticking out?
No, actually, I feel like I'm pretty healthy.
Okay.
Um, I just can't get this menopause behind me.
Yeah.
But I
No,
mean, I guess that's part of being healthy too, is cycling for so long, maybe. I don't know.
yeah. I think that what I tend to see is a down regulation of endocrine function, like ovarian function, with women who maybe have autoimmune or inflammation. Those things can potentially uh,
Hmm.
cause that earlier transition into menopause.
Hmm.
What I'm going to do is I'm going to drop this down here in the chat for everybody. This is a PDF on estrogen metabolism and how all of that works. Whoever wants to download that, you can. That's a lots of really good information talking about those different phases of estrogen metabolism and
Okay.
potentially why a test like this would be very beneficial for someone like you.
Okay.
Any practitioner could order this type of test for you.
Right. A Dutch test.
Dutch
Yeah.
test.
Yeah, I know I've done it in the past. I think I just ordered it online from a private lab and had it done myself and took it to my doctor.
Yeah.
So, yeah.
I think the other piece is making sure that someone knows how to read that because there's
Right.
no formal training on that. That's all
Hmm.
a further education. As an OB or really anybody who's a MD can prescribe hormones, it doesn't mean that they have experience or done any further education on that. And
Right.
your provider may be great, but I just always say like, hey, you want to make sure if someone's handling your hormones because it's going to impact everything in your life, you want to make sure you have
Hmm.
somebody knowledgeable to be able to help you with those things.
Yeah. All right. Thank you.
Absolutely. All right, Andrea, we got a question here. Bioidentical HRT with the history of DVT. Is there an increased risk? Which pathways are preferred? If which hormone? So, with DVTs, birth control is probably one of the top things I see with blood clots. Something you'd want to see if you're predisposed to that. Oral estradiol is probably the form of estrogen that could cause issues with DVT. There's limited data supporting that. But anybody in an integrated practice tends to not use oral estradiol. One, it's really hard on the liver. And two, it's very going to act very similar to like how your body processes it versus like a synthetic estrogen. That could be more problematic for an individual. Andrew, did I answer your question fully, or did you have any additionals on that? All right. Does anybody have any
Sorry,
additional
yeah, it's okay. I have to find the right button. Um, how about progesterone, bioidentical progesterone? There's no problem. Is it just the
from
estradiol?
from what I've seen, yes, probably more estradiol. Testosterone, if given in high amounts, really tend to see this more in men when providers overdose them. It can make your blood very thick. For a woman, getting up to physiological or slightly above range, less likely for you, but maybe a potential. But I do see estrogen tending to cause a lot more of those issues versus the
Okay.
other two. But testosterone is something you want to be aware of. So if you're on that gel and your
Yeah.
hemoglobin, hematocrit, your red blood cells are starting to pick up, that is a potential there. So that's why we usually recommend screening and doing enough diagnostics
Yeah.
to
Yeah.
kind of catch that. But I tend to not see that as much in women. It tends to be a lot more in men.
Okay. I'll get tested tomorrow and I can also talk to her about that.
Yeah.
Um, yeah.
You're using a topical estradiol, though, correct?
Yeah, the gel.
The gel.
I'm not using estradiol yet.
Okay.
Just the testosterone.
Yeah, and I think we've probably spoke about this a couple times, but doing things in stages may make sense, especially if you have
Yeah, yeah.
some other health issues going on. Having one change at a time versus throwing the kitchen sink in and wondering why you don't feel well and then trying to reverse engineer that. One product at a time probably is best, and then testing and then refining that dosing before doing additional things.
Yeah, I'm not planning to add any HRT, any more HRT for now. Just measure how they look like at the moment.
Yeah, and if you're going to do your labs tomorrow, my recommendation is not applying your testosterone gel or cream the morning of, because your numbers are going to be very
Yeah,
high if you're just dosed it and then you walk in to get a blood draw. So not a lot of people tell their patients that, but something that we do at our clinic is that
yeah,
we're going to go 24 hours. We're going to catch you at your trough, at your lowest point, see if we're giving you enough. And if you're still
yeah,
really high, maybe we need to reduce, or if you're really low, maybe we need to add some. Versus you go walking in and it's sky high, and you're like, I just applied
yeah,
it, so
exactly. Yeah. Yeah, I
give you more
use it in the
insight.
morning, so I took it this morning and have to test tomorrow morning, so it's fine. It will be 24 hours.
Yeah, I think that is best case scenario for you for sure.
I'll send you the results once I have them.
Absolutely. Um,
Thank you.
yes. So, how can you tell if you're getting enough testosterone? That's a good question. I would probably one test would be an important piece of that. So, things you would want to consider with that, if you are still cycling and you take too much testosterone, can cause issues with inovulation. So it can throw off your ovulatory, your luteal phase. We see it a lot in things like PCOS. If we have an excess of androgens, they tend to have luteal or ovulatory defects. So one, testing to make sure you're within a good range. And two, symptoms are going to be important as well. So, depending on what the symptoms are, I could see brain fog, general fatigue, low libido, um, low energy, poor recovery after exercise. Being able to see improvements in maybe those metrics would be a good place to track. You also see probably improvements in body composition. But what I would like everybody to think about is testosterone is given as off-label therapy for women. The FDA has not approved that. Just as a lot of things coming up in medicine, there's just not enough data. So a lot of it's going to be symptom driven. So being able to correct symptoms. And last piece with that is women have been misunderrepresented in healthcare in general. Most studies are done on men. There's very little done on you and your body. So, for me, I want to be, even though I am a man, I want to be an advocate for you all and kind of give you as much information as I can because, SSRIs, antidepressants, and birth control are not the answer for, all the women here on this call. There's a lot of other things you can be doing. KTM, I hope that answered your question. If you have any additional insight, feel free to drop that in the chat or unmute yourself. All right, this is going good.
Did Jasmine leave?
It looks like she did.
Okay, I have the information now.
That's Sophie's client, I think. Is that correct?
She's Charlotte's client.
Charlotte's client.
Yeah.
If you
Okay.
want to send that over to her.
I'll send it. I'll put it in the chat, Charlotte.
Thank you.
Yeah.
Lisa, what have you been seeing out there? Is there anything specific like you've been navigating through? I know you're doing a lot of intake calls, and I know we were talking last week about mitochondria testing and mitochondrial peptides, and just wanted to see is there anything specific you're seeing a trend of, or any questions that I could answer for you?
I think the biggest thing is, sometimes I have clients that are doing all the right things. They're working with, an integrative doctor. They're taking BHRT, but they're just still having a lot of symptoms. And so, I've talked to them about, Charlotte's detox protocols that she has, making sure the liver and kidney pathways are opened up. Also, what you've discussed on getting things working to a cellular level. So, doing that, but if there's any more information that you could give me that I could say that would be a little bit more helpful for them, to give them the reassurance, because I think sometimes what happens is when somebody feels like they're doing all the right things, they feel like, yeah, right, it's too good to be true. I guess I'll try this. A lot of autoimmune issues out there. And like I spoke with a woman the other day who actually did become a client. She got diagnosed with Hashimoto's 30 years ago and has never taken any therapy for it. And she's suffering highly as a result of it. So it's things like that I'm running into quite a bit.
Yeah, I think that's pretty common. I tend to see that a lot of people kind of migrating into my clinic from various places. And I think the big piece is having appropriate diagnostics is probably a starting point. This estrogen metabolism PDF I put in here for you, that would be something I would share with people. I think people tend to have a hard time believing things if we're just telling them, but if you can give them data supporting that of like, hey, have you looked at some of these specific avenues? You're taking all these hormones, but you're having tons of hormonal shifts, maybe estrogen related. If you haven't looked at doing any of these things, this is a great place to start. And I think like the big piece is, I met with the client yesterday, and she's going back and forth with her doctor. She's 42, having a consistent menstrual cycle, and they want to put her on estrogen. And she's fighting that she has a thyroid issue. And we both agreed that, it's probably thyroid related. Some of her weight gain and issues is having an integrative provider who actually listen to you. I think a lot of times I see patients coming in and they're just kind of doing what they're told and not really questioning things. And for us is just being patient advocate and giving them enough information to make an educated decision. So that's one piece. And then, yeah, having the appropriate medications available. Some of our partnerships through this program, lots of things are accessible to really anybody in the United States as far as different treatments, and having a team that's actually well educated in all those areas is going to be helpful as well.
Hi.
I hope that provides some insight.
Yeah, no, it's definitely helpful. The more information I have that I can share with them, the better. Just kind of reassuring them to really even just get that second opinion. A lot of people have labs and they worked with many people, but yet they're still experiencing these issues. And so, encouraging them to get that opinion along with, further testing and just really trying to get to the bottom of what truly is impacting them.
Yeah. I'm going to drop a couple more things here. So here's some literature. This is a bioidentical hormone debate by Ken Holtorf. It's a very, very interesting piece comparing synthetic hormones to bioidentical hormones. This is actually older data. He's been such an advocate of this since the Women's Health Initiative came out. He actually did this publication talking about the safety profile of bioidentical hormones. So this is something that I share with people who are hesitant or unsure of what to do. So this is a very, very good one. And then I have one additional. Let me see if I can pull this out as well. And I will drop this. So this is something that I presented to this hormone or this program years ago before hormone replacement was integrated here. And this talks about menopausal hormone replacement therapy and the reduction of all-cause mortality in cardiovascular disease. It's about time and timing. And I think this is something that should resonate with a lot of women. And it really talks about those first few years of peri and postmenopause of when you're going to have the most damage control of managing your hormones. So someone not waiting till they're 60 or 70 to get on bioidentical hormones, this specific article, let me see if I can share this with everybody because I like pictures. Talks about the progression of atherosclerosis. And if we look at vascular system and how that fatty streak accumulates over time and loss of estrogen and aging on diseased vessels. So without estradiol, vascular responsitivity, expression of estrogen receptors, those things are going to cause issues with the hardening of arteries. So this is a very good article explaining a lot of that information and just the introduction of early HRT versus HRT later and how that disease progression could be prevented if you're doing that early enough. I know hormones are not for everybody. A lot of people don't want to take them, but I think you should at least be open-minded to that conversation and kind of look at some of this data because the cardio protection alone, it's not a coincidence that women, the risk for cardiovascular disease goes up exponentially when you go into menopause. Most women are not going to have a cardiovascular event while they're still making a lot of estrogen. We tend to see men have that issue. And if we look at our hormonal profiles, we make a lot of androgens and low amounts of estrogen. Y'all are going to be the inverse of that. And that's why you're at such a low risk for cardiovascular disease until you hit menopause. So I don't really think about it even in the sense of aging gracefully and having nice skin and, keeping good body composition. I think really a lot about just the longevity. I would not want to be on a statin or having open heart surgery if you could potentially avoid some of those things by introducing hormones safely and well monitored. I think has a lot of purpose. So I think that's helpful. B has a question here. What are HRT and other recommendations to help with estrogen if someone has a check 2 gene mutation? My gyno doesn't seem to know. That's a good question. What I would say, so I've seen several gene mutations. My provider I work with now and a previous provider I worked with, and I think I said this a couple weeks ago, testosterone replacement therapy seems to be very safe. you're going to have a low aromatization rate, so that you're going to still make a little bit of estrogen from that. That may backfill and help with that cardiovascular function, the neurological function, but maybe not too much to increase that potential that mutation. Other places I would say to look at is, I don't know how old you are, but looking at diagnostics now to see if you have any inflammation, if you have any issues metabolizing your estrogen. Do you have any thyroid issues? Those things I think really matter in genetics and epigenetics, versus just taking hormones. I'd kind of get a clear bill of health, kind of what everything looks like, and then build upon that. Oh, Lisa, I see your message here. I thought I heard Nancy. Nancy, I met with you last week. Do you have any questions for us? Are you still here? Oh, I think she's gone. Thank you, Lisa. I didn't hear her. All right, we got 10 minutes. Does anybody have any other questions for me or anybody on the team? I feel like this was a good call, and I think we could probably get in one more if anybody has anything.
Okay. I have a quick question. I know that when you looked at my labs and I had a high vitamin D level in my blood. Now, how is that metabolized out of my body? Can it, because I want to be able to resume, because I have osteopenia and I don't want to have kidney stones. So I know that it's going to take a couple months, but could you explain that process to me, please?
So it is a fat soluble vitamin. I think some of the things that we were looking at initially is additional input. You were taking, I believe, like a 5,000 IU, and then you're taking, I believe, like a calcium with the D, and then you had a multivitamin with the D. So we were getting, I don't know how many IUs of vitamin D, but quite a bit. So, to my understanding, just a reduction of that dose. So instead of, say you're at 10,000, maybe go down to 2,500. That over the course of a couple of weeks should reduce that. The other piece with the osteopenia is enough vitamin K to help with that absorption into bone. You may be doing that. Really, you being north of 100, you should still have enough vitamin D present, even if you didn't take it for a couple of weeks, till you get down to an 80 to help with that absorption of calcium. But I'm never going to pretend like I know everything. I'm not 100% sure that's something I would want to look further into for you. Do any of you coaches have any insight on that? What would be your recommendations? Is it a reduction, or is there something specific you would do to lower vitamin D?
I missed if she was on supplementation. She's not on supplementation?
Like
She
three
is.
different forms. Yeah.
Yeah, I'd probably back off for a while, definitely.
Yeah.
But I also think you can correct me if I'm wrong, Justin. The vitamin D that we're testing for in the blood is not the same type of uh there's different types of vitamin D, but this one that we're checking in the labs is not actually the one that tells you how much is stored in your bones. It is the active form that's circulating in your blood. So I don't know if anyone else can comment on that, but definitely I would stop supplementation for a while, um, because I do think that cofactor of too high of vitamin D can lead and kind of manifest kidney stones. But again, someone can correct me if I'm wrong. But overall, yeah, if it's high on the blood lab, I would stop taking it and see what happens and retest.
And I have those vitamin Ds you're talking about. So I actually had somebody want to test all these specifics. I'll drop these in the chat just for knowledge for everybody. Ashley, I see you unmuted yourself. Did you have any additional on top of that?
Yeah, I was just going to say that, like, so vitamin D is fat soluble, right? So, I mean, obviously it's going to be stored, and it's going to be stored in the liver will also store some some of your vitamin D. Ultimately, so if you've been, I'll just say like taking higher than your body needs at the moment, then you'll store the excess. But if you stop or reduce, like you will utilize what's stored. Your body will utilize what's stored. That's what it's there for. And so it will start to go down. Depending on how deficient you were before you started supplementing, would go into play as to like what I would recommend as to like whether to just stop for a little bit. I think a better recommendation is, again, depending on what you have, is to go, twice a week taking it or something like that, can be a good option. But basically your body will use it. It's not, sure, like if it stays super high in your liver for long periods of time, like that can cause issues, but that's like a really like longer, higher thing. If you know that it's high, back off or stop or do it intermittently for a while and then retest, and see where you are. But it's not, it's something to be mindful of, but not the end all be all, because like the excess you have, your body will utilize. So just back off or start to go down. And yeah, I was going to talk a little bit about the difference, but you go ahead and talk about the difference
I
of
would
the vitamin D.
just drop them in here. These are the three that I actually have the ability to test. I had a client want to test these. I'm not as savvy on this, so I'd love for you to kind of go into the specifics on the difference of the Ds.
I wasn't going to say a whole lot. I mean, basically, your serum vitamin D is just looking at the circulating form of vitamin D. And so that's what you measure easily on a lab test, right? It is produced in the liver, but it's not necessarily the active form. It's like your body like pulls out the active form as you need it. So that's what I was saying, like the excess will be utilized, right, as you need it. But then, yeah, so you get the vitamin. So then you have vitamin D stored in the liver, and so which you get through supplements or sunlight or whatever, and it's stored liver and fat basically. But your body has to convert, or the liver converts it. Liver converts it when your body needs it, and so I was just going to say that, like, it's not. It's just the difference of like whether it's converted and whether it's an active form. And so anyway, that's all I was going to say.
Yeah, so maybe giving you some clear-cut direction, Nancy, is you can reduce your dosing. You're still going to have plenty to help with that calcium absorption. And then over time, maybe retesting your vitamin D with a single source included to make sure that you have enough and you're not overshooting would probably be my recommendations. So I hope we answered your question there.
You did. Thank you very much.
Yes, ma'am. All right. Well, I will again say it one more time. We got maybe questions for, or time for one more question if anybody has it. And we're coming up to our last 3 minutes here on this call. If we don't have any questions, I will let everybody go. I appreciate everybody joining the Hormone Happy Hour. Love doing this call. Thankful for everybody who joins. Coaches, appreciate your insights. I will see everybody next week. Thank you. Bye.